Hi everybody, this is Kevin with Garrison Dental Solutions, and I'm down here today in beautiful Silver Springs, Florida with the absolute queen of the rubber dam system, Mary Costello. And Mary has lectured all over the country, hundreds and hundreds of lectures, teaching at everything from dental assistant schools to trade show events and everything. Worked for Colteen, Whale-Dent for many, many years as their continuing education manager. And so we're just super happy to have her here with us today to talk about some tips and tricks for rubber dam placement. So without any further ado, Mary, take it away.
This evening we're going to focus on three topics that usually are very challenging for individuals when they're applying dental dam. The one is, of course, selecting the appropriate clamp. The second topic we'll discuss using the winged and wingless clamp in the easiest manner possible. And the third, of course, we'll do a demonstration of a quadrant isolation, and we'll discuss tips and suggestions for placing the dam for that upper left quadrant. Basically, as a quick review, let's talk a little bit about the clamps. The dental dam clamps come in winged and wingless. Now, on the please make a note of the anatomical portions of the clamp. There are 4 points at the jaws of the clamp. So in order for a clamp to be stable, you need 4-point contact. And also, when you're selecting your clamp, if you notice the diagram on the lower portion of the slide, you can see what happens when you select something too large or too small. When you select something too small, there's not enough tooth structure being encompassed by the clamp. Obviously, too large, the clamp is not going to fit at all. So the correct image explains where exactly those 4 points should be contacting the tooth surface at the proximal areas. When you're selecting also a clamp, you have to take into consideration the condition of the tooth. By that we mean, is the tooth partially erupted? Is it structurally compromised? There are specialty clamps that can be used for these particular purposes, which we'll discuss shortly. Now, just for those who might have forgotten, the tooth that receives the clamp is called the anchor tooth. On the clamp jaws, there's basically 4 styles of clamp jaws, and this pertains mostly when we're dealing with the molar clamps. The 4 styles are, for example, are flat jaws, such as the number 3 and 7, as you can see in the diagram, the 7 series and the 3 series. There's curved jaw clamps that are appropriate for use on the upper arch, such as the number 8 series. Then there are the curved jaws that have the points moving in a downward direction towards the gingival tissues. The A that follows the number means apical. Now, these particular style clamps are utilized for partially erupted teeth in either upper or lower arch. The flat-jawed clamps generally fit better on the lower arch, and the curved-jawed clamps will fit better on the maxillary arch. Then we have a specialty type clamp that are referred to serrated jaw clamps, such as the 12A and the 13 pictured in the slide. These have little tiny serrations at the inside of the jaws, which give the clamp greater gripping power. So these are specifically beneficial when used for structurally compromised teeth that are generally fully erupted but have a buccal or lingual wall missing. Endodontists like these clamps for that reason. For those individuals that are particularly just learning how to use dental dam, the color-coded Fiesta 9 clamp pack is a very convenient way of recognizing which clamps to use for what particular purposes.
Now, weren't these several years back, I think Reality Publishing was pretty high on these color-coded clamps. I remember when all that came out. So
Yes, as a matter of fact, this was my idea.
Oh, look at you and your big old brain. Fantastic.
Yeah, well, you want to hear the story?
Yes,
Okay.
I think it's very relevant.
Well, my husband and I were discussing about a clothing line called Garanimals, where the upper, the tops and the bottoms matched. So when he said tops and bottoms, I thought upper arch, lower arch, color-coded clamps. That's how.
Wow, that's like the lightning bulb, the light bulb.
That's exactly how that happened.
Wonderful.
So anyhow, we developed the color-coded clamps, and yes, it did win the Reality's Best New Product of the Year award, and it actually won subsequent years after that too. As a matter of fact, there's a photo there on my wall. With that, but nevertheless, basically, what we've done is the anterior clamp is red coated. This number 9, that's used for root canal therapy on the lateral centrals and canines, both upper or lower arch. The earth tones, the green and the brown, are the bicuspid clamps. Now, these are kind of universal. They can be used either upper or lower arch. The 2A is a little bit, the jaws is a little bit structured to go subgingival. So if you have a bicuspid that is questionable as to whether you're going to get the clamp to stay on, the 2A would be the appropriate one to select. And then the rest of them, the molars, they're as I mentioned, the flat-jawed clamps. As you can see, the difference between the two, this being the flat-jawed, and here's your curved or cupped jaw, and I think you can see the difference between how the jaw shapes are. As I said, flat jaws better on the lower arch, and the curved jaws fit better on the upper arch.
Yeah, so you can see how that kind of dips in.
Yeah, you can see that. And then you have your subgingivally style clamps, such as this one here. Okay. All right. Can you see even further? It's curved, but notice how the points of the jaws tilt
really dip down
in a gingival direction. And these can be used either upper or lower arch when you have a partially erupted tooth, or if you have an oddly shaped tooth. The other thing too is you want to consider the size of the tooth. For example, if you'll notice your 14A, your 8A versus your 14A, can you see the difference in the size of the clamp? By that, I mean, if you look at the points of the jaws from mesial to distal in this direction, all right, see like this, from here to here, that if you have a smaller tooth, obviously your 4-point contact is going to be located at a point where the distance is less than if it was a larger tooth. You see what I'm saying?
Yeah, absolutely.
So essentially, if you're looking at a tooth, you want to tell the size of that and imagine where the 4 points are going to be contacting the tooth surface, and then you select a clamp that'll accommodate that size and you just determine it by looking at it from mesial to distal width in that direction. As you can see, the number 4, for example, is a little bit smaller than the 7. And you see how this is a greater distance there. Okay. So your 7 can be used on a larger molar. Usually I like a number 3 if it's a medium to small molar. So it just depends.
And that's really just a judgment call that you're making when you're looking at that patient going, okay, I think it's going to be this or it's going to be that. And
yes, exactly. And I really don't remember all the numbers. There's so many clamps. And that's another thing, too. The clamps in this series, you would use 80% of the time. The 80-20 rule.
Absolutely.
And then here's your serrated clamps. And one thing I did want to make a mention about the serrated jaw clamps, and you might notice some other clamps also feature the same type of situation, and that one side of the jaw is wider than the other. Can you see? This is wider. And this is wider than this side. Well, these are a paired set of clamps, all right? By that I mean the wide side, or the bigger side, goes to the buckle aspect. So an easy way to remember when you get a clamp that has offset jaws like this, if you think of BB, big buckle. And so therefore, this clamp would be on your lower right, upper left, and vice versa for this one. So again, even though the jaws are flat, I still, if I'm faced with a structurally compromised tooth, and even if it's in the upper arch, I'll use this style clamp because I know it's going to stay. So essentially, because of the serrations, yeah. And so basically this whole set is autoclavable, and it organizes your system so that you can easily locate the clamps that you need when you need it.
So they can put that whole set on the board through the autoclave.
Yes, correct. But we do recommend drying the clamps off and drying the clamp board off before you put it into your autoclave bag. So that's the System 9 Fiesta 9 clamp pack. For those of you who are really reluctant to use a clamp, there are times when you can use a product called Wedge's Dental Dam Stabilizing Cord. This cord acts like a little rubber band, and essentially you just stretch it and it just pops through the contact like that. And there's non-latex products, which is lime green and turquoise, and then the latex product is orange and yellow. And the size, the color also denotes size. So if you can see that the lime green is size small because it's thinner, and the turquoise is large. The yellow is small in the latex version, and the orange is large in the latex version. So these can be used in place of using a clamp, but you do need a contact in order for those to work. What we're going to do now is we're going to do a demonstration of how to properly use a wing clamp. Usually what happens, many times individuals will use a wing clamp, the same method that they use for a wingless technique, and that would be placing the clamp on the tooth and trying to stretch the dam over the clamp and tooth, and then they wonder why the dam tears. Well, that's because they're doing it the hard way. So we're going to teach you the easy way. Now, of course, your clamp is sterilized, and before we put the clamp on a patient, we need to put a safety floss on our clamp, and that's in the event if the clamp becomes dislodged, you want to have the ability to retrieve it.
We recommend that on, our sectional matrix rings as well. Even if you've got the rubber dam in place, put a piece of floss on that.
Okay, that's a good idea. Well, I'm going to teach you probably a method that you may not have seen before, and that is because when I first learned how to apply Dental Dam, I placed my safety floss and tied it in the center of my bow. And although clamps are made of a fine a very good quality stainless steel, from repeated uses, which is kind of hard to tell how often you're using that particular clamp, eventually the metal fatigues and you have a possibility where the clamp could break in the center. Well, you could well imagine what happens then, because if my little floss is in the center and the clamp splits away from that, then I have nothing on the other end of my floss.
And two pieces to fish out.
And two pieces to fish out is right. So what I'm going to do is I usually get a piece of floss that is as wide as my shoulder, and then I fold it in half. And notice I have a loop at one end and I have a little twirled threading end here. Now what we're going to do is we're going to engage the clamp so the floss is threaded through the lingual side of the clamp. Now we're going to isolate tooth number 19. So that means this side of the clamp will be on the lingual and this side is on the buccal. So we start with the floss through the lingual side of the clamp. And we're going to make a slip knot, or some of you might know it as a luggage knot. Just take the end and feed it through the loop and pull tight until the knot is tightened into place. Make sure you're on the outside of the jaw and towards the back of the clamp. And then we're going to take the floss and wrap it 3 times across the bow. And then we're going to thread it from bottom to top. There we go. There.
Well, that makes perfect sense. Now, no matter what happens,
yeah,
you got
so
it.
Right, if it breaks on you, you have the whole thing. Okay, so that being done, the next step is we're going to take our piece of dental dam, and some of you might need some assistance as to where to place your holes. Of course, I have applied dam for many, many years. I pretty much can visualize where I want to put my holes. However, there is a template that you can use, and this comes with by the way, we're using a non-latex dental dam, and the template that comes in the box, you can simply perforate the holes and mark with a felt tip pen. Just like that. Now, to make it easy, in the wing technique, the dam, the clamp, and the frame are carried to the mouth as one unit. So, you can mark your dental dam, and then, now this frame is a little bit different from what some of you might be familiar with. This is the radiolucent frame, hygienic frame, and the engagement is such that the dam is placed on top of the frame and not behind it like most other frames. So once you have your dam in place and you have it on the frame, it's actually much easier to punch your dental dam when it's on the frame. See? Otherwise, you could punch it off of the frame, but it's flopping. Okay, so, and you can actually make it so that it's not so taut. A little bit of a leeway there. And there's 2 ways you can insert the clamp into the dam. You could do it with your fingers, laying the clamp parallel to the dam, and just stretch the wings so that they're underneath, as such. Or, if you want, you can insert the clamp into the forceps, as such, lock it so it's in a locked position. Now when it's locked, don't put pressure on the handles, it'll unlock your device. So you can handle it anywhere except the handles. And you can just simply lay it in like this. And then now when you go to the mouth, you're going to put this in an unlocked position. Alright, so now we're ready to go to our patient.
What's our patient's name today?
This is Oscar.
Oscar.
Yes, Oscar. But he's not a grouch. Okay. And so when you come into your to your patient's mouth, you want to come in parallel to the tooth structure. Okay. And then you slide your lingual jaw into position first, and then your buccal jaw. Once your clamp is seated, you check. Put a slight pressure to check to make sure the clamp is thoroughly seated and it's not rocking. So it's stable. That's what you want. Now another thing you can do with this floss, for example, with this frame, you can just simply wrap it, release a corner and then wrap it around this way and then reattach the prongs. Now what that does is that if for some reason the clamp should pop off, it's not going to go across the room and do any...
Any of these things that are under spring tension, if they come off pretty aggressively.
They do. I've seen them fly across the room. And so, now we're not quite done yet. What we have to do, I don't know if you can see, the wings are still underneath the dental dam. If you left this in this manner, saliva would come up through the holes. So what we have to do next is we're going to take our beaver tail instrument, our composite instrument, whatever you want to call it. Now, there are 2 ends to the instrument. One I call a beaver tail end, And then the other end I call a check mark end. It's like a golf club, actually. I use this end because what I'm doing, I'm going to lay the instrument on its side and push the dam off this way. Because you don't want to do this with your instrument because you're going to poke a hole in it. Sure. So by using the side of the instrument, and don't forget your finger rest, folks, you just slide and just take an edge and slide it off just like that.
Perfect.
Now, you can turn the instrument in the other direction and go this way with it, or on the lingual you have more room, so you can also use a finger to pull this off. But when you pull it, you want to pull sideways until it clears the wing, because if you put too much downward pressure, you're going to tear the dam as well.
So now I heard it kind of, there was like an audible little click as it
yes.
popped off of there.
Yes, exactly. So then now we're okay. See, everything is sealed off and we're ready. Obviously, single tooth isolation, you could be doing either an occlusal, or you could be doing, well, your most popular treatment would be root canal therapy. And sealants is another option too. The clamps I usually use for sealants are part of the Dr. Brinker series. Those are the B2 and 3. Now these also have offset jaws, if you notice. What's unique about the Brinker series is the fact that these are also used for when you have a class 5 subgingival on the buccal or lingual of a molar. I know these are small. These kind of don't quite follow the pattern exactly when you're selecting the clamp, because as you notice, the jaw over here is much smaller. You would look at this and you would say, oh wow, that's not for a molar.
Yeah, it's like a premolar.
But actually, where these engage actually on the buccal and on the lingual surfaces. They don't engage totally in the proximal areas. And the reason is because they're designed to retract the tissue in that area, because that's where you have your class 5. So these are uniquely designed for that purpose. But I also found, but because these will stay on the deciduous and permanent first molars that come in, when you're doing sealants, they're not thoroughly erupted. These will stay on. So I usually use some topical at the gingival area, and then I'll use these clamps. And again, there's a right and they're a paired set. See that this side's bigger than this side. But anyway, these are specialty type clamps. Another one of Dr. Brinker's clamps is for gingival retraction when you have class 5 on the anterior part of the mouth. We'll discuss these in more detail a little bit later, because what happens, many people confuse the number 9 use. Oh, this happens to be a wingless number 9. By the way, the W stands for wingless. If you had a wingless number 9, you have to actually put the dam on the tooth first and then follow up with your wingless clamp, because there's no way you're going to stretch the dam over these bows. But the wing number 9, see the difference? They have tiny, tiny little wings. They're really small. Oh, yeah. See how small they are? And actually, if you're using a non-latex dam with the number 9 wing clamp, normally if you say number 9, that means winged. You need to actually punch the hole size a little bit smaller.
Because it'll stretch.
Because the non-latex dam has more of a slippery surface to it, and so the wings won't stay in. So I usually go like a number 3 hole, usually. When you do your hole sizing, we have a chart you'll be seeing very shortly that'll show you what hole sizes are appropriate for what teeth. But generally, the anchor tooth receives the largest hole in your punch, and it goes in descending order. For example, this is an Ainsworth style punch. It has 5 holes, and so your 5 holes for your anchor tooth, 4 holes for molars, and then 3 holes for premolars and canines. The number 2 is for upper anteriors, and the number 1 is for lower anteriors. Now, if you're using another style punch, An Ivory Style punch, for example, that has 6 holes. I never use the 6th hole on that one because it's way too big. Because if your hole size is too large, what happens is you're going to have leakage around the necks of the teeth. And then you can't invert properly either because the dam won't turn under. And we'll talk about that procedure in a little bit. But anyhow, what I wanted to make a mention about the number 9 and the Brinker clamp is that the number 9 is a very stable clamp, but it is a very aggressive clamp. So you have to be very careful when you're using this clamp. And this
aggressive as in how?
The spring in it. It's aggressive because the spring is really strong, and so you have to be careful when you're using it. But the thing is when it's placed, you see this slope here. Okay, that's always placed to the facial aspect of the tooth. So, for example, on the lower arch, the direction of its placement is this way.
Okay.
Okay. On the upper arch, in that direction.
Okay. Yep.
Okay. It is used as a retaining dental dam clamp. Now, the retractor style clamp, another style is a 212, is a similar type of a clamp. These do not have any holes in here. They've got notches. You see the notches here and here? These notches? That's where you engage the clamp with your forceps. These are the jaws of the clamp, and you can see they're very narrow, and they're designed specifically to retract the dental dam and the tissue to get access to your class 5. These are not very stable when they're applied to the tooth. They have a tendency to rock. These are never used to retain the dam in and by itself. Usually either Wedgett's cord or other retaining clamps can be used, and then this is used in conjunction to give you the retraction, which you'll see when we do our quadrant isolation, because we'll show you the procedure for using this clamp. That is your wing technique. Now, when you remove your dental dam, is easy. You just simply insert the clamp forceps into the holes of the clamp, squeeze on the handles, pull straight off, and the dam and the frame come off together. It's always advisable to have the dam and frame come off together. I've seen situations where people will remove the frame and then they try to engage the clamp, but by that time the dental dam falls forward and you can't see what you're doing. So just try to keep it as a unit when you remove it. All right, now the next thing that we're going to talk about is using the wingless clamp. Now, we're going to talk about how to use a wingless clamp. The wingless clamp is used, there's 2 methods actually. The traditional method is placing the clamp on the tooth and then stretching the dam over the clamp and tooth and then applying the frame. This becomes more difficult the more posteriorly you go in the mouth, particularly if you're isolating that last tooth in the arch. I have a technique that I've used. I dubbed it modified wing technique. And what that does is you're going to insert the bow of the clamp into the dam before you go to the mouth. So it eliminates that step. So let me show you how that works. So again, if you have, actually we could probably use the same dam that we already punched. One other trick I want to show you, particularly when you're using a wingless clamp, it's a good idea to make an orientation hole in the I always use the upper left corner of the patient's mouth, because with a wingless clamp, the dam has a tendency to twist in the mouth. So if you're doing radiographs for endodontic therapy and you have to take the frame off, when you put the frame back on, if your dam is twisted, then it doesn't lay right. So that helps you know that that's where that hole is supposed to be all the time.
That makes a lot of sense.
Yeah. So now, when we use a wingless clamp, in order for the dam to slip over the clamp very readily, we're going to use a water-soluble lubricant, such as a surgical jelly. And all you need to do is place a little bit on the side of the dam that goes towards the patient's mouth. That's commonly called the tissue side of the dam. All right, you don't need a lot, just enough to go ahead and lubricate that. And of course, it's really important to use your ligated or safety flossed clamp, particularly when you're using your wingless clamp, because you have more of a chance of that coming away from the dam. So we're going to do the same thing. Again, we're going to thread it on the lingual, and we're going to put the floss through the loop, and we're going to wrap 1, 2, 3. And if you come from bottom to top, you'll see why I do it that way when we use the wingless clamp, because it's easier to retrieve the floss and bring it to the surface. Here we go. All right, so I find the easiest way to do this is to engage my clamp. By the way, I know some of you get confused sometimes on how to put the clamp into the forceps. So let me show you a little trick here. I always place the clamp in the forceps so the bow is up facing me. And whether I'm on the lower arch, I'm palm down, and when I'm on the upper arch, I just turn the forceps over and I'm palm up. So you don't have to be switching things.
Always load it the same way.
Yes, load it the same way. So again, I'm palming the forceps. I lay the dam on top of the forceps. With my thumb, I'm holding the bottom of the dam. Yep. And then my other hand is just simply popping the bow through. Just the bow, like this. Yeah. All right, so I deflect the dam so it's out of the way. And when I go to the patient's mouth...
And wingless clamp like this is generally what we recommend for folks when they're doing a class 2 and using a sectional matrix system, is there's less clamp to interfere with the separator ring. So.
Yes, I know what you're talking about. This is on the wing clamp, the part that interferes is this projection right here. Mm-hmm. Now, some clamps have a smaller projection, and that's okay. That probably wouldn't interfere. But definitely on the wingless clamp would be your choice when you're using, I have a class 2 and you're using matrices systems. But this is an easy way, this technique, modified wing technique, is an easy way to apply your clamp. So normally you would get your patient's cheek out of the way using your index finger, and then we're coming in parallel to the occlusal surface. Notice I'm using the tooth structure gently to guide the clamp into position. You see what I'm doing here? It's a very controlled motion. The tooth surface is guiding the clamp into position. So
just kind of opening it up slowly as you feel it go around the infrabulge.
Yes. So basically, you slide the lingual jaw into position. You open the clamp wide enough to clear the buccal height or contour. Then as you get past the height of contour, then you slightly close the clamp so it's sliding along the surface of the tooth and guiding into place. Again, I'm checking to make sure it's stable. Now at this point, I am going to open the dental dam. And we're not quite ready for the frame yet because the cheeks will keep it forward like this. But can you see now we got the bow exposed? Mm-hmm. Here, it'll look something like this in the mouth. All right. We have to expose the remaining part of the clamp and the tooth. With your index finger on top, thumbs underneath, you want to pull up and over until the entire clamp and the tooth are exposed. Okay, so now we got everything exposed and the dam is secure around the jaws of the clamp. Now we're ready for our frame. Now let me show you how I do this. And I'm showing you how I do this when I'm working by myself. Obviously, if you have someone to assist you, an auxiliary to assist you, your auxiliary would hook the one side of the frame and the operator the other, but I'm showing you how I do this by myself. So I come in parallel, I'm at 11 o'clock operating position. I come in parallel to the patient's face. Notice the bottom of the view of the U is by the chin, and the curve is curved out facing, following the curvature of the chin. So with my non-dominant hand, I'm going to hook the left side since I'm dominant right. Now my left hand holds that side while I hook. Basically the trick is to hook the two corners on each side, and then I could engage the rest of the prongs once that's done. And now
it up as needed. Yeah.
Let me show you now, in order to get your floss out, all you have to do is get your instrument here. You see why you want it threaded from the bottom to the top, and then again you could go ahead and release the corner and just secure it into position. And then to remove your clamp, again, simply engage in the forceps into the holes and squeeze, take off the clamp, dam and frame come off together.
So now this with the wingless, it doesn't all come off at the same time.
No, you always take the clamp off first, and then the dam and frame come off together. So then that goes for whether winged or wingless. Yes. Okay. So essentially, that would be the two methodologies I would recommend, that you can use those techniques when you're doing single tooth isolation, when you're doing a quadrant isolation, you can use those as well. So speaking of which, let's move on to our quadrant isolation. When we're using a frame for our quadrant isolation, we're going to isolate the upper arch. So generally speaking, here's what I do. Let's do a run through. Here's my patient. Hello, Miss Patient. How are you today? Okay, I normally check the arch. We have some restorative work that needs to be done. We're going to be doing class 5 on number 9, and then we have class 2s on our bicuspids, our canines, and our laterals. So we're going to check with dental floss. And what we're checking essentially is we're checking to see how tight the contacts are, and we're going to check if the floss is fraying, you may need to smooth down that area on the tooth surface. You know, usually an old restoration may need to be smoothed down. You're going to remove it and replace it, so you don't want any edges that are going to be causing the dam to tear when it's rough like that. So anyway, so we're checking for the contacts and also for fraying of the floss, and so far we're okay. So in this case, we're going to isolate teeth 7 to 14. We're going to be placing a retractor clamp on number 9, and the reason why we go a few extra teeth across the arch is because normally the retractor clamp is placed so that it's stabilized. Now, I know some individuals will stabilize it using a green stick compound, which is a technique we learned like years ago. I think some schools still teach it. I generally can't teach it at the schools because it requires an open flame, and I don't want to get into the liability of that. So, but I do discuss the issue of stabilizing those types of clamps, so something to think about. Anyway, so here we are. I'm checking to see if there's any malposed teeth, any missing teeth, because I have to accommodate for those situations. But this guy's pretty, Miss Smith is pretty good, so she doesn't require anything. All right, so here we go. So I'm going to my dental dam. Now, as I mentioned, you can go ahead and mark your dental dam if you'd like to mark it. I would, again, I know where I'm going to put my holes, but for those of you who may not be so adept at doing this, we're just going to mark our dental dam like that for the upper arch. And as I said, it's easier if you put the dam on the frame and then punch your holes. Here we go. Okay, so we're going to take our punch, and again, we have the diagram up for your reference, and just simply go ahead and punch your holes appropriately for the hole sizes. Now, sometimes it depends on the size of the teeth, but sometimes you may have to go a whole size smaller when you're using a non-latex dam because the material stretch is a little bit more so than your latex product. So what happens sometimes is you may get a little leakage. So if you notice that the person's teeth are maybe a little smaller than normal, I would go the whole size smaller. How the non-latex differs from the latex product is that, other than the fact that it's non-latex, is that they've adjusted the modulus of elasticity. Now, that's basically the stretchability of the product, you know, all these fancy terms. But non-latex dam is easier to stretch because the modulus is lower than the latex product. So that's the reason. All right, so we have our dam all set up. Now, you have the option, if you'd like. We have also the framed Flexidam. Now, with this particular dam, it has an integrated frame. The curve goes by the nose. This is the top of the frame, and this goes by the chin. This is particularly nice when you're doing endodontic therapy because the frame is flexible enough. You don't have to worry about removing a frame to take your radiograph. So it saves a lot of time, and the whole thing is disposable, so you know, you don't have to worry about sterilizing the frame and going through that. But in either case, either framed or this is called ready cut dam because it's pre-cut, will work. Okay, we're gonna use the framed dental dam, and so when we're setting this up, by the way, it doesn't matter really if you have the frame showing here or here. Of course, it looks a little bit nicer when you have it this way. Now, when we're using a wing clamp, we don't want to use lubricant on the this is called the keyhole. The hole that gets the wing clamp is called the keyhole. So you don't want to use lubricant on that hole because the dam will slip off of the wings. So we're going to use the wing technique, and let's see, what did I do with that wing clamp? Okay. Where'd he go? Here he is. Oh, I want to show you how to clean up. When you clean this off, it's really easy. All you need to do is we're going to take the floss is going the wrong way. It's going to end up on the lingual. If you cut the slip knot like this,
everything comes apart.
And it comes apart just like that. Okay, so if you're using the wing clamp, you're going to put the clamp in first. Now, we do use the water-soluble lubricant on the remaining holes. What that does is it facilitates placement of the dam between the teeth. So we're going to now lubricate the remaining holes. If you were using a wingless clamp, you would have lubricated all the holes and then put the wingless clamp in. All right, so now we're ready to go to our patient. And it's a good idea to explain to your patient what you're going to be doing. And the benefits of using dental dam is going to keep the material from going down their throats, and they're going to be much more comfortable. I think sometimes individuals are concerned about the fact that, oh, the patient can't breathe and that sort of thing. Well, that's not true. I mean, if they have a cold, that might be a problem. But one thing about the frame Flexidam, my mom, 93 years old, bless her soul, now she's passed, but when she hated to go to the dentist, but my dentist would let me put a dental dam on her, and she'd fall asleep in the chair. So the nice thing about the frame dam is it doesn't hug the face as much as your ready cut dam because the frame
less claustrophobic.
Yes, feeling. Exactly. Yeah. So if you have a patient that has a problem with claustrophobia, this would be an ideal type of dam to use. Okay, so what we're going to do is the sequence of placement is important. So the first thing we're going to do is we're going to come in and we're going to seat our clamp, again following the same procedure. And then before I go too far, I like to stretch the dam off the wings, because if I tear it now, I haven't invested a lot of time.
That makes very good sense.
So,
yeah.
I'm going to take my instrument again and just stretch it off. There we go. Now on the upper arch I have plenty of room, and I can use my index fingers to just pop it in. So I've anchored the posterior. Now the idea is to come and anchor the anterior. I find that by doing that, I know as simple as that sounds, my holes will line up perfectly. Instead of trying to line them up coming from the posterior to the anterior and then anchoring lastly on the anterior. So here I am. I'm going to go to number 7, and I'm going to take our dental dam, and I'm going to take my little wedget cord, and I don't need it that long, so I'm going to trim it up a little bit. There we go. So now notice how the holes kind of line up for you. Can you see how they line up? There we go. Now, usually what happens, individuals have problems getting the dam between the teeth. And that's because they try to bunch it and force it through.
Well, and probably if they're not lubricating it, that's going to add to the
Exactly.
difficulty.
Exactly. So what I'm going to show you is called the knifed edge concept. And what it is I'm taking this edge and I'm going to line it up and I'm going to bring it through the contact.
So I see how you're using your fingers to stretch it thinner.
Stretch it thinner and bring it through. Now, where the contacts aren't too tight, this will work perfectly. But back here, if you notice when I was testing the floss, I had my tighter contacts here, which is normal in most people anyway. So what I'm going to do is a combination of a knife edge concept with using floss. Now I'm going to use my floss to line up the edge and gently bring it through the contact. This is called the loop technique because I'm looping the floss and I'm going to bring in a little bit more material with me. Notice? And then I'm going to pull this out through the facial. Okay, I'm going to have to repeat the process because I'm not thoroughly through the contact yet. Again, there we go. And there. This is called loop technique. Now I'm going to go on to the next. Taking a little bit more in. You're basically feeding it in gradually. And the lubricant is facilitating this as well, you see?
So now what would be the most difficult or the most common thing to go wrong? Would it be tearing the material at this point?
Yes. Yes, exactly. And that's why you want to use the loop technique combined with the knifed edge concept because you're not bunching it, you're actually pulling it in. The floss is carrying that material in for you. By looping it, you're being very efficient because you're not taking a whole lot of floss through the contact. Okay, now the next step is inversion. Now when I'm working by myself, well, first let me talk about if you have some help. You want to make sure that the dam is thoroughly between the contact in order for it to invert. Otherwise, it's not going to invert very well. But normally, if you have someone to help you, they would blow air at the gingival sulcus. Well, I guess what we do is we would suction everything dry, and then they would blow air with a triple syringe, and you would lay your instrument at a 45-degree angle and just tuck it under. Now, if you're working by yourself, I'm going to show you a trick that I do. I use a flossing mechanism. Now, usually back here, I can take my floss, I'll loop it, and I basically will floss the proximal areas, the interproximal areas, using my floss. And just by tucking it down, just by doing that, many times in the molar region, the posterior, it'll roll right under. Now, canines, they're always difficult to invert. Another trick with using floss is to floss the distal, come in and floss the mesial, grab the two ends, take your instrument and tuck the dam and the floss, see, just like that, and then cross it gently. I do mean gently, you don't want to injure the patient's tissue, just gently like that. This is a very good technique because when you have a class 5...
Because by crossing it, you're drawing it all the way around the tooth.
Exactly.
To roll it down all the way around.
Yes.
Okay.
Now, at this point, I could take the distal piece of floss and come out. Now, instead of coming out of the contact, I could continue on throughout the whole arch. So this is what I find that I do when I'm working by myself, because it's easier. Now, I'm going very slow to demonstrate this procedure, but I usually go much faster than this. So, but you see how you can move across the entire arch like this? Just simply and see how nice it inverts? It really does a nice job. When you have someone that, depending on the clinical crown, some clinical crowns aren't erupted very well. This technique will give you access. And sometimes, if your class 5 is not subgingival, let's just say it's just right in here, you don't necessarily need a retractor clamp. So it just depends on how deep that carries.
Look at how well that is
lesion.
sitting in there. That's just perfect.
And so, there we go. And then just simply invert. See, the inversion is important because it seals the dam around the necks of the teeth. Just like that. And see, it's perfectly inverted. Now, let's continue on with the class 5. So normally what would happen in the sequence, you would go ahead, doctor would prepare the teeth. Now, when it comes to the class 5, and you need your retractor clamp, then you could place that on. And I'm at 11 o'clock position. If you're a left-handed person, you're at 1 o'clock. And remember I told you there's notches on either side. That's because if you're right-handed or left-handed, see? So in my non-dominant hand, I hold the clamp the way it's going to go. Again, notice the slope. It's to the facial aspect of the tooth. So I engage the notches that are closest to my dominant hand. And then when I apply this, I want to gently slide the clamp very gently along the tooth surface, very gently, and seat it like that. Okay.
Yeah, and it may not be easy to see on camera, but as she was sliding it down, slowly opening it with the forceps, following the contour of the tooth, and then once past the natural contour, releasing it a little bit so it stays tight against the tooth as you're pushing it down.
Exactly. And this is what I'm talking about, see? It can rock. So normally what we would do is I know Green Stick Compound is a very old product, but it's very stable when it's hard and brittle when it's in its natural state. But when you heat it up, you would heat it up until it melts like taffy, and then you would put it in a little warm water to temper it a little bit so it's not so terribly hot. You would have a wet gloved hand, and you could take a little piece off of it while it's still in the taffy state and roll it like a little cylinder, and you would lay the material over the bow so it extends over the bow and partially on the teeth. So it encompasses both sides. Same thing over here.
And that just kind of...
And that's what it does. You use the air syringe to cool it, and then when it solidifies, it'll stabilize this. Now, again, I'm not sure if all the dental schools still teach that technique, but you can see why you wouldn't want to use this as a retaining clamp, because it's just not sufficient enough to do that.
But in combination with the wedge.
Right, we have the wedget on this end, and we have the clamp on that end, so we're fine. So anyway, so at this point, doctor would go ahead and prep the tooth. We would restore it. Then if you have a compound on there, you could use a scaler and just flick it off, the compound off with the scaler. So then you would remove your gingival retractor clamp. Again, just squeezing on the handle. There you go. Now, the removal process from here, well, before you continue with removal, then the rest of the teeth would be restored. And then once they're restored, and we're ready to check the occlusion, we're going to take our dental dam off. So the wedget cord can be removed simply by pulling it through the embrasure, like this. And it's always best to move from front to back. You want to cut the interseptal dam, that's the material between the teeth. You need to protect the patient's lip. So I put my index finger here in the vestibule. My scissor, which is curved, is going to be pointed away from the tissues towards the incisal edges. And when you cut, make sure the entire blade encompasses the interseptal material. Because what can happen, let me see if I could try to demonstrate what can happen. If you don't, you can see what will happen. You can get a little ring of rubber around the necks of the teeth. And if that remains, that ring of rubber will migrate to the apex, and it'll actually cause the tooth to avulse. So,
so rather than just pulling it up through.
Yeah, so you're pulling the dam away, and then your scissor is cutting here. Now, see, one thing about using the wing clamp, and this, Kevin, as you mentioned, this is where the little projection can be a problem with your matrix systems. This also could be a problem when I'm trying to cut this off. So I try to keep the clamp on if at all possible. But if this is in the way, I'm forced to remove the clamp. I'm taking the retaining clamp off. I try to take that off at the last minute, it's the last thing besides the frame. Okay, but if that's not the possibility, then I have to go in here and do it like that. Now your dam and frame, or your, like this, is already integrated, come off together. And then it's very important that you check for missing pieces. So what you want to see are the holes that you punch and the slits that you made to remove it. If there's any missing piece, you need to go back with dental floss, retrieve it, and match it up. Make sure that you have all the pieces. And that is how you would do a traditional dental dam placement using the wing technique.
Well, thank you for attending this evening's course. Up on your screen right now is the course verification code, and you'll have to put that on your course evaluation and quiz when you fill that out. So jot that down just a minute. We'll send you that evaluation and quiz in just a few minutes. It takes us maybe 10 or 15 minutes after the conclusion of the event to get that out to you. Please complete both of them and send them back to us by the end of the month. We do go through those and make sure that everything is correct, so it takes us a couple of days. So after you submit your course evaluation, it will take several days before you get the verification back from us, so don't be surprised about that. If you're an AGD member, please be sure to include your AGD member number in the space provided, and that way we will go ahead and submit that to the AGD on your behalf. Now, if you have questions or concerns about the course here this evening, please feel free to shoot us an email at webinar@garrisondental.com. Webinar@garrisondental.com. Thanks for attending.